900 AM, the talk of the Palm Beaches.
I want to be on the cover of Forbes magazine, smiling next to Oprah and the Queen. Oh, every time I close my eyes, I see my name in shining lights. Yeah, a different city every night. Oh, I swear the world better prepare for when I'm a billionaire.
Well, hello again, South Florida entrepreneurs and wantrepreneurs. Welcome to Scoring Your Business, a program brought to you by Palm Beach Score. Just in case you haven't heard of us, we are a 41-year-old Palm Beach organization that exists solely to help small businesses in the county grow and prosper. Whether you are a startup business or one that survived the economic turmoil of the last few years, if you are ready to grow your business, then we are ready to provide you with your own personal mentor who will help you plan a prosperous future. Because we are a local nonprofit and receive our financial support from major corporations, we are able to offer our mentoring services absolutely free. And trust me, our mentors, who are all volunteers, have some pretty impressive resumes. Nearly all were or are founders, CEOs, CFOs, or COOs of both large and small companies. They have walked in your shoes and understand the responsibilities and challenges of being the top decision maker in an organization. Check us out at palmbeach.score.org. It is a connection that will give you a helping hand to make your business the success you know it can be. I am Penny Pompey, Palm Beach Score's chairman, and your host for tonight's show. Have you ever come across an article on the web that was so obtuse that even if you had a vague idea of the subject matter, you could not figure out what was being said? Subject matter experts get so wrapped up in putting their ideas on paper that they forget real people have to read it and then try to make some sense out of it. You really don't have to look any further than instructions issued by our IRS for what they consider to be a standard form. Now consider this treasure from the introductory paragraph of a 1099 form instructions. Quote, beginning in 2014, an FFI with a Chapter 4 requirement to report a U.S. account maintained by the FFI that is held by a specified U.S. person may satisfy this requirement by reporting on Form 1099 under the election described in Regulation Section 1.1471-4D5IA. Now, does anybody have any idea what that sentence means? Of course not. It's not in English. But the industry that is the worst offender of undecipherable language is the medical and pharmaceutical industry. Now, we're not talking about doctors' handwritten prescriptions, because I'm convinced they learn in medical school the worse your handwriting is, the better your patients think you are. So, as all good entrepreneurs today do, our guest, Karen Vieira, is the founder and CEO of The Med Writers. She found a need and she filled it. She has a PhD in biomedical sciences, an MBA from University of Florida, and a BS in biological sciences. She has seen firsthand the inability of scientists and researchers to be able to produce documents that can be understood by their target audience. Who is it that is supposed to understand what they have written? She has also been blessed with an ability and a passion to write, a skill in increasingly short supply everywhere. She has tapped into a little-known market that has doubled in size in the last 5 years, increasing to over $1 billion today. Medical writing is the fourth most frequently outsourced service, and much of that outsourcing right now goes to Asian, with particularly Indian and Chinese companies seeing it as a huge growth area. It is defined as a technique used to write clinical and scientific information intended for a wide range of audiences in a suitable format. The target audiences of medical writers range from doctors to patients to pharmaceutical companies to contract research organizations. But as a medical writer, you first have to have an in-depth understanding of the subject matter, and you have to know the intended audience. Joining Karen on the program is SCORE mentor Evilio Sardina, who has extensive hands-on experience in consulting, publishing, and communications, particularly in the healthcare field. He was also founder, editor, and business manager for English and Spanish language publications in the medical industry. Welcome to the program, Karen and Evilio. We're delighted to have you with us today. This is really going to be an amazing show, and I can hardly wait to learn about an industry that I had no idea existed until I started researching for this program. Okay, so Karen, tell us how you made the decision to launch a startup company in this brand new industry.
Thanks, Penny. I'm glad to be here, and that's a great question. I think unlike most entrepreneurs, I didn't really make a decision. I just kind of got my feet wet in it, and then all of a sudden I was all the way in the pool. I had a job, and I started writing more of a time killer because I was pregnant and on bed rest, and I can't sit still. So I started writing because it was the only thing I could do on bed rest. And I had all this knowledge, all these books I love to read, and all these medical journals I read. So I started writing, and it just became a passion. And then people started seeing some of the things I was writing, and some of them were owners of small businesses or somewhere in the healthcare field, and they would say, hey, can you write something like this for me? So I actually got on to some of the freelance websites that were around. This is back in 2007. And I created a profile, and I started getting work. And it just kind of snowballed from there. And here I am, nearly a decade later, still doing it with a great team. And now with the help of SCORE, really looking to grow the business.
Well, it's the American success story is alive and well and living here. And I have to tell our listeners that the blessings of South Florida, Karen was born in Barbados, right? Correct?
Absolutely.
And Evilio was born in Cuba.
That's right.
So it just tells you how great South Florida is with
multinational.
This diverse culture that we have growing here. So, Evilio, do you want to you've got a lot of background to tell us about. So can you condense it to a 2-minute overview of what you've done in your past lives?
Well, in my past life, in my immediate past life, I would say for the last several years, I started a medical publishing company in New Jersey in 1980. And one of the reasons for that is that I had identified some of the areas of communication needed in the healthcare industry. And one of those was primarily in terms of niching the communications so it wouldn't be diluted among many other types of publications or articles within medical journals and so on. So that was an idea that prompted me to start that company, and I was very lucky. That was very successfully run for 15 years.
Well, congratulations, and welcome to SCORE. We're delighted to have you. Evilio just joined the SCORE as a mentor just a few weeks ago. So you're brand new on the job, and now you have your first client with Karen.
Well, I'm delighted, Karen. We just had a little conversation of that, but I'm still puzzled with your very impressive academic credentials. What made you decide for getting into the industry aspect of this business as opposed to getting an academic appointment?
Great question. I grew up in a family where my dad was an entrepreneur, and I just have entrepreneur blood. There is no entrepreneurship in academia. I mean, I know they have those cute little incubators and the tech spin-offs from the universities, but it's all a fallacy to help the professors not feel so boxed in. There's no real entrepreneurship there. And my very first job after doing my PhD, I was probably making more than my PhD professor was making. And so he made fun of my job at first until he realized what my starting salary was. So I left and went to industry, partly because of money, but partly because I just, I left from having a job to being an entrepreneur because I knew that was where I was heading.
Plus, your professors had to be writing grants to survive.
Absolutely.
And you were benefiting from their grants. And
Yes.
you were just hoping that their grants were granted.
Absolutely. And I was very, very fortunate that I picked a lab to do my PhD in, which was a new lab with a young professor who was very vigorous and energetic and had no problem with writing lots of grant applications. And, sometimes we were there all night working to get the data to publish to get the grant money. So, it was quite a productive lab and quite a lot of, thank God, a lot of grant money rolled through.
So I have another question. How do you get your clients? How do you recruit your clients and in that business?
Very good question. So when I started the business, like I said, I started on some freelance websites. Back then in 2007, Elance was the big thriving freelance website. It's not around anymore. It's kind of gone through a merger and different things. But I still am on a lot of freelance websites. My company has a profile on Upwork, Guru. We're on different websites. But we have evolved from there to now several different things, actually. We do some outbound marketing where we're contacting people in different corporations. We actually just started doing some outbound marketing with the federal marketplace because I know there's got to be a need. The federal agencies like FDA, CDC, NIH, and so on. So we've gotten the business is now certified as a woman-owned small business and a minority-owned small business, and we're working on some other minority certifications. So we're marketing in the federal marketplace. But a lot of people that find us, it's because we write good content. And I will take credit for that. I write good content. And so people find the website. They find the company website through one of the blog posts, usually that I've written or somebody else on the team, just because they typed in some keywords into Google.
But when you write your articles, who decides where those articles are to be published? Are they hard copies? Are they mostly online?
Everything. We do such a wide range of things. We write articles that are for the web, which, now is called content. Everybody wants content for their website. But we do, anything. Some people come to us and they want an article written that's going to be published in a magazine, or we do brochures, like a trifold type brochure. Sometimes we even write the text that's going to go on a package for a product or a dietary supplement. So it can be online, it can be offline. White papers, medical journal articles, just a wide variety of things we write.
Now, Karen, you have a very impressive website. And in your website, I also notice a very impressive list of scientific writers and consultants. Are these people full-time members of your staff, or are they freelancers primarily?
Primarily freelancers. That's how you get good talent. Because good talent is all over the country and in many different places. So, for example, we have some members of the team that freelance with us, but they actually are professors at great universities, places like Johns Hopkins and things like that. But they just need a little side income because even though people think we have doctor in front of our name, so that means we make a lot of money in academia, scientists don't make a lot of money in academia. And so they actually need sometimes a little side income. And it works great. It's beneficial for me because if I need an expert in a specific area, I can tap into some of those freelancers. But some are full-time or part-time with us as well. So we have a mix of the two.
You also have a very diversified stable of writers, from neuroscience and mental health experts to naturopathic experts, environmental and occupational health. That's very impressive.
Yeah, absolutely. And I found it to be necessary because, like I said, being on those freelance sites, anything can come at you. And so people are like, I need a scientist that knows about cell biology, neuroscience. It could be anything. And so if you're not able to have an expert in that field work with them, they might not be able to, choose you. They want to choose somebody else who is an expert. So we've learned that we've got to have those experts to tap into.
Okay, I need to break in here. What a wonderful conversation. Thank you very much. However, it's time for us to bring some messages from our Palm Beach Score clients to our listeners. Please remember, if you are interested in talking to Karen or to Vilio, you can call us. We are reachable at 877-960-9960, or you can tweet us at #ScoreYourBusiness. We'll be right back in 3 minutes and continue our discussion about medical publishing.
Are your business financial records a mess? You know in your head where the money goes, and more importantly, when it comes in and from whom. But staring at the year-end brings pangs of guilt, because you promised your accountant months ago that this year you would do a better job. We promise if you attend this quick workshop on Thursday, November 10th, you will learn easy and quick ways to keep your company's financial data up to date. And even more important, how to understand what all those numbers are telling you. Register online at palmbeach.score.org or call 561-833-1672. Use promo code TALK to receive a $10 discount.
The MedWriters is a team of medical students and doctors that simplify complex medical topics into easy-to-understand articles, reports, books, brochures, and more. Most articles written by the MedWriters get to the first page of Google searches for one or more keywords. The MedWriters also formulate dietary supplement blends and has naturopathic doctors that provide expertise to supplement companies. Visit us at themedwriters.com or email us at info@themedwriters.com or call 877-438-8748. We are your communication team.
Are you or do you know a woman business owner? Even today, there are special challenges awaiting women who step out into the entrepreneurial world. Palm Beach Score is committed to helping these women achieve unparalleled success in the small business marketplace. Whether they are just starting out or have been around for a while, join your fellow women entrepreneurs on Thursday, October 27th, beginning at 8:30 a.m. for a provocative discussion about two different subjects. First, how to survive working with your spouse. And second, how to use simple golf knowledge as a business development tool. Register today at palmbeach.score.org or call 561-833-1672. You'll be very glad you did. Use promo code TALK to receive a $25 registration discount.
Are you a small business owner that is ready to grow your business? Are you frustrated by the naysayers or the complex new regulations mandated when you grow past a few employees? Maybe you just need to get a line of credit to finance expanded receivables. Join Palm Beach Score at our annual Financial Management Symposium, Show Me the Money, on Friday, November 4th, where you will find the experts to help you solve all of your growth opportunities and challenges. Space is limited, so register today at palmbeach.score.org. Use promo code TALK to receive a $25 registration discount.
I wanna be on the cover of Forbes.
Welcome back to Scoring Your Business on 900 AM, the talk of the Palm Beaches. This is Penny Pompey, and we are talking with local entrepreneur Karen Vieira about what I call her medical translation business, along with Score mentor Emilio Sardina. Remember, if you are a business owner and would like to have a mentor, simply reach out to palmbeach.score.org for a personal and free mentor. Remember, if you have a question for our guest today, just give us a call at 877-960-9960. One of the things that I noticed, Karen, on your website that kind of fascinated me is that you have an expertise in knowing how to write FDA compliant marketing materials. That has to be a specialty within a specialty. And I know that regulators are notorious for their own obtuse regulations that appear designed to catch the unwary. What can you tell us about the services that you provide for that?
Yeah, absolutely. That's a big need right now in the marketplace, because even though the FDA is very hands-off with certain things like dietary supplements, it doesn't mean that just because they're not checking every single supplement that they're not shutting people down because of what they're saying in their marketing. And so it
happens. We see it in the newspapers all the time. They get slapped or shut down.
Yep. And so what usually happens are, the FDA sends out a letter, the company is freaking out, and they've got a certain amount of time to basically fix their marketing, or they're going to be shut down completely. And so they're running around, I call it with their hair on fire. They're just freaking out. And so we're able to save the day in that instance because we do edit or rewrite their marketing, whether it's just their website. Sometimes it's like actual physical, brochures and packaging and stuff like that to be FDA compliant. Now, this is a tricky thing because the FDA is constantly changing what they, deem as acceptable. And I've seen in the last year, especially, a lot of people getting shut down for marketing that would have been considered compliant 5 years ago. And so it is a very important thing to keep up on the landscape of what they are, looking for and what they're considering to be acceptable now rather than based on old standards.
So to kind of follow up on something that Avilio said, how do you find these companies that need your services? Do you kind of go through the paper and find out which company's in trouble now and say, hey, by the way, I can help you?
Usually with a situation like that, they find us because we have some blog posts and stuff about those types of topics. And so a lot of times they type something like that into the Google search, and somewhere or website pops into their search results and they contact us. Sometimes it's that they're on a freelance website like Upwork or Guru, one of the sites that we have a profile on, and they're searching for somebody that can help. And one of our marketing people kind of goes through the listings in there every day and will place bids, giving quotes and contacting people that have done posts in there. So they may see us through that kind of venue as well.
I think another issue here is that pharmaceutical companies, when they are looking for writers or to do something like you provide, the service that you provide, they generally do not have writers in the staff. The medical departments do not have writers in their staff. So there is some employees in the medical department that will write not only the package inserts or the guidelines and whatever, but they're not really writers or scientific writers. And you provide that kind of service that is very much needed in the industry.
Yeah, absolutely. That's actually been a bit of a challenge. That's one of my speed bumps to the company's growth, is that a lot of times as we are now going out more, doing outbound marketing to these biotech, pharmaceuticals, or even, healthcare organizations, and speaking to people within those organizations offering our services, they go, oh, no, we're good. We do that in-house. And it's like, really? Well, who do you have in-house doing it? And sometimes it's the scientists. And we all know that most scientists can't write for a general audience, as Penny already pointed out at the beginning. Or sometimes they've got marketing people who are like journalists, which is great, but they don't understand medical terminology and the real in-depth, crux of whatever that topic is. They can't dig into the literature.
I think you provide also the aspect of independence that separates the bias of the company employees or the people in the marketing department or in the medical department. And you provide that independent view or independent position to those articles.
Absolutely. And when we write about products, I think a lot of times we find aspects and angles that internally they're too close to the problem to even see what the real benefits sometimes of their product or service is to their actual customer. And when you take that 10,000-foot view and look, kind of at the broad landscape of their specific product or service, it's easy for somebody like me to come in and see all the different benefits and to write about it really succinctly.
So let me just ask one question. So on that same vein, it seems to me doctors and researchers have a fairly big ego. And so how do you handle them when you go in and say, this is terrible? I'm sure you don't use those words, but, this really has to be rewritten because it's not doing what you need it to do. Are you a psychologist too?
Yeah, that's just some tact and kindness. So, for example, there's a project where I'm in the stages right now of discussions, and it's with a large healthcare academic type company that's well known, in America. And they have a problem where they're launching and they have all this content that is written by these scientists. And the scientists have it written so that it's like for a physician to read. But they want to sell to the general public. Nobody's going to be able to read this stuff. So there is somebody on the team that recognizes this problem and has reached out to me to provide a quote and provide, a little bit of our company background to come in and help. Now, at some point, am I going to probably have to deal with some of those scientists that wrote that stuff that I am now hired to rewrite? Yes. How do I deal with them? Gently and kindly. With a lot of praise and a lot of thanks for writing this great material. And then I go do my job, which is to rewrite it, as you call it, Penny, translate it into something that a lay audience can understand. Because a lot of times things need to be written at a 6th or 8th grade level, because we have to take into account that in America we have such a diverse population, and especially with so many people now coming from different countries and English is their second language. We can't have super complex documents because they won't even understand what you're trying to sell them.
Well, it concerns me a little bit with some of the stuff that I was looking at today, that so much of this work is outsourced to India and China, and it doesn't seem to me to be a good fit.
It's a horrible fit.
It just doesn't.
So everyone on my team, I only have a few requirements. You have to be able to translate, as you call it, and that's what I call it too. You have to be able to translate the medical jargon into English. You have to be able to understand, which means you have a PhD or an MD or some type of degree that ends in a D. And English has to be your first language. So everybody that works for me is either American-born or maybe Canadian-born, British-born, but a country where English was your first language. Even if you migrated to America from there, it doesn't matter. But if English isn't your first language, for me it's difficult because then I'm going to have to spend too much time in the editing part of the process. And then that's going to just eat up my profits. So absolutely, if you're a native English speaker and writer, so much better. The results are so much better. The clients are so much happier. So I can't imagine the results that people get. You can tell when you go to a website and everything was written overseas by a non-native speaker because you read it and the sentences don't make sense.
Right.
Speaking of profits, that's part of my concept about business. And one of my questions is, do you get paid by the authors that you write for, or do you get paid by institutions that commission this work for you?
Absolutely both. So some of our clients are doctors, dentists, chiropractors, people that own a clinic, some kind of hospital, whatever. Sometimes it's scientists, researchers within academic institutions or within corporate institutions, pharma, biotech, whatever. So sometimes we're dealing with the individual and they're paying us directly. Sometimes it's a corporate project, in which case we're getting paid by the company or the academic institution, the whoever in the department that deals with the payroll and that type of stuff. So it's quite diverse, actually, and it does pose its challenges because every different big corporation and institution has different terms of which they like to pay. Some will pay a deposit up front. Some will pay 100% up front. And others, we have to check it and then you bill us net 30. Mm-hmm. So I deal with a lot of those types of road bumps.
And because generally speaking, the honorarium that doctors get from publishers are not that significant.
No, a lot of times when we've got doctors coming to us to write, for example, I was working on a project today, earlier just before I came here, we were wrapping up a project that was for a doctor who's a researcher at an academic institution, and we're being paid by the academic institution, probably through his grant money. And it's a book chapter. He's being published in a book, and he kind of had bits and pieces everywhere, and it really needed to be pulled together and polished up and made nice. And with something like that, he's probably not getting any payment for being published in that book that chapter in that book.
Right.
It's just it's the credit
prestige.
The prestige, and then he can list it on his next grant application and hopefully get some grant money.
Right.
But he's paying us, not a small amount of money to edit it and polish it up and make it nice, because it's important to him to get it published just for his own career development.
Besides your websites and your blogs, how do you market your business?
Well, I have a few assistants that work with me doing marketing. And so email marketing, we make some phone calls. Good old cold calling isn't dead. I mean, I really prefer, obviously, when we get the inbound leads where people found us and they contact us, because that's an easy close. If they found us, we have what they need. When we're going out trying to market and, networking events and stuff like that, it's quite
a shotgun. You don't know if you're going to hit something or not.
Yeah, so we're pretty new to that, to be honest with you, because all these years we've run off of people finding us. And now the last couple years, we're starting to do the outbound marketing where we're trying to contact people. And I would love some mentorship on that, to be honest with you, because I am not good at it.
One of the things that I saw on your website, again, is that your services encompass a whole lot of stuff. So you talk about web design and marketing and writing and editing manuscripts, and you even mention SEO, government literature, Spanish translation, grant writing. I mean, and developing, helping them develop formularies for alternative medicines. I mean, you do a lot. So if you're doing cold calling, how do you know what to offer that person?
That's a great question. So there are a few things that we enjoy doing. We are great at. We make decent money doing it. And our team, are experts in it. And so those are the things that we focus on. So, for example, writing content. Like Penny mentioned, most scientists and doctors just can't write those articles for the web because it just sounds like total medical jargon. And there's a huge need there because right now content is king. And the MedWriters team, we are kings at writing content. So
there's a new tagline.
Yeah. So that's one area where, we will contact companies and say, hey, who's writing the content for your website? Who's writing your newsletter articles and your, the stuff on your blog? Because we know that we can do that and we can show a great track record of doing that for so many companies and them being so satisfied with the results.
You ever consider starting your own publications?
No, I haven't. But it sounds like it might have been quite profitable for you, so I'll consider it. If you're going to hold my hand through it, I'm not going to say no. I'm a serial entrepreneur.
I don't know that I can make any guarantees.
That was a good one.
Well, it's time for us, with all this frivolity, to take a very quick break in order to bring you some very important messages about Palm Beach SCORE and our small business clients. Remember, if you are a small business owner, Palm Beach SCORE exists solely to help you solve business challenges in this very challenging business environment. Discover the details on our website at palmbeach.score.org. Please stay with us. We will be back to you in 3 minutes.
Interested in speed dating a banker? Wouldn't it be nice to sit down with a banker for a quick chat and walk away when it's clear to you that they're not a good fit for you or your business needs? Not to worry, because at the next desk is another banker who is eager to talk with you to see if there is a fit. You will have a room full of bankers, each one committed to working with small business owners to help solve your financial needs. Plus, choose from 9 different workshops throughout the morning on financial management topics relevant to a small business. Get into the driver's seat of steering the financial needs of your company. Space is limited, so register today at palmbeach.score.org. Use promo code TALK to receive a $25 discount.
The MedWriters is a team of medical students and doctors that simplify complex medical topics into easy-to-understand articles, reports, books, brochures, and more. Most articles written by the MedWriters get to the first page of Google searches for one or more keywords. The MedWriters also formulate dietary supplement blends and has naturopathic doctors that provide expertise to supplement companies. Visit us at themedwriters.com or email us at info@themedwriters.com or call 877 438-8748. We are your communication team.
Are you or do you know a woman business owner? Even today, there are special challenges awaiting women who step out into the entrepreneurial world. Palm Beach SCORE is committed to helping these women achieve unparalleled success in the small business marketplace. Whether they are just starting out or have been around for a while, join your fellow women entrepreneurs on Thursday, October 27th, beginning at 8:30 a.m. for a provocative discussion about two different subjects. First, how to survive working with your spouse. And second, how to use simple golf knowledge as a business development tool. Register today at palmbeach.score.org or call 561-833-1672. You'll be very glad you did. Use promo code TALK to receive a $25 registration discount.
Are your business financial records a mess? You know in your head where the money goes, and more importantly, when it comes in and from whom. But staring at the year end brings pangs of guilt because you promised your accountant months ago that this year you would do a better job. We promise if you attend this quick workshop on Thursday, November 10th, you will learn easy and quick ways to keep your company's financial data up to date. And even more important, how to understand what all those numbers are telling you. Register online at palmbeach.score.org or call 561-833-1672. Use promo code TALK to receive a $10 discount.
I wanna be on the cover.
Welcome back to Scoring Your Business, a program brought to you by a nonprofit organization, Palm Beach SCORE. And we exist solely to help small businesses in our county grow and prosper. Whether you are just starting out or been around for a while, like today's guest, Karen Vieira, we are here to help you, and our services are all free. Give us a call right now, and we'll get you on the air. Dial 877-960-9960 and ask your question. Both of our guests today have boatloads of information to share. So, Karen, we're going to talk about your business now. As a business, do you have a funding source, or was this all self-funded from the beginning?
It was all self-funded from the beginning. And now as I'm looking to grow the business, I'm realizing, okay, if I'm going to go after some contracts that are much bigger than I'm accustomed to, and I'm dealing with corporations that will pay on sometimes a net 30 or net 60 basis, which means I have to finish the work, submit the invoice, wait for the invoice to be approved, and then wait 30 to 60 days to be paid. I've got to pay my payroll in between there. And so depending on how big the projects are, I may need to look for a funding source. And that has become evident to me that there are options out there. I know that there's, for example, an SBA Express line of credit. I've done my homework.
All right, good.
Very good.
SBA backed, and the banks will take the risk on of a small business when the loan is backed by the SBA. So I've kind of looked into the options.
Under certain circumstances.
Under certain circumstances, right. So I've kind of looked into the options that are out there, but I haven't moved forward with anything yet.
Well, I'm going to put in a blatant plug here. So you need to come to our Show Me the Money event on November 4th, because that's when we're going to talk all about what funding is available to all small businesses in the area. So mark that on your calendar, Karen.
Great, and I'm sure it'll be great. I've learned a lot at a lot of different types of events like that so far, and met a lot of people sometimes in the micro lending and kind of the alternative funding avenues as well.
Right. So what are your growth goals? Where do you want to take the business? Do you want to be national? Do you want to be international?
Yes.
All of the above.
We kind of are national and international already, in that we have clients all over the country and all over the world, to be honest, because writing is such a virtual thing where, we can talk by email, we can talk by Skype, you can email me documents, put them in a Dropbox or whatever.
So easy, yeah.
And so it is very easy for me to work for clients all over the country and all over the world. But I definitely, interestingly enough, I would like to expand locally, because most of my clients are not local. And I'm a people person. I like to sit down and talk with people and meet people. And it's kind of exciting, even though, sometimes it's fun to be lazy and at home. I like to get out and about sometimes. And so it would be nice to have more local clients. And there are a lot of healthcare institutions. Biotech is popping up big
Right.
here in South
Yep.
Florida now,
Up in
and
Jupiter.
pharmaceutical. So I have to figure out how to get into some of those organizations and have conversations with the decision makers there and start getting some local business. I could use some help with that.
I think you have an opportunity to really expand your business in that area, which probably you have not really tapped yet, which is the industry itself. Even though there are a lot of complexities in the healthcare market today, and the companies are holding back. Many of the pharmaceutical companies are holding back. They have still a lot of money, and they are the ones that require the exposure of their products and other concepts and new developments. Drugs are in the pipelines and things like that. And here's what may be a good niche for you to explore.
Yeah, absolutely. And you know, one of the things that I like about this business is that I always say it's recession proof, because medical and healthcare related, businesses, they're not going anywhere.
No.
Our baby boomers are getting older and they need more healthcare, and pharmaceutical drugs are just being pumped out every day. Like, this stuff is not going anywhere. There's biotech research companies popping up every day as new technologies and new, discoveries are made. So, and all this stuff needs to be written up somewhere, and everybody has a website that needs content on it.
and needs new content on it.
Yeah, and they want new content on it every week.
Well, in order to keep your SEO rankings up, you've got to keep
Absolutely.
having new stuff put on there.
Yep.
So you're here to help. Is that
I'm
right?
here to help, and I feel like this business is recession proof, and that it will be easy to grow just because of the industry and the incredible growth that's happening in the medical and pharmaceutical and biotech industries right now.
Well, and evidenced by the fact that your business, not your business, but the industry you're in, is now $1 billion industry.
Oh, yeah.
So that's a nice piece, a nice pie to be able to go get a significant chunk for yourself. What has been your biggest surprise about being an entrepreneur?
I think my biggest surprise is that I always saw myself as a finisher. Meaning I was the one that, I made it through. I saw so many of my friends drop out of the PhD program, it wasn't even funny, because that thing was not easy. But I'm a finisher, and in business, I will start, we're going to do this marketing initiative, and I'm going to start writing up the plan, and here's the text we're going to use. And I have so many half-done documents on my hard drive, I started calling my hard drive a morgue. So I may not be the finisher I thought I was, but I have learned to delegate, and I've learned to surround myself with other people who are finishers, who it will drive them crazy if the project is not seen through to completion. And so I have one great person like that, Jonee, who helps with a lot of the marketing. And so I can toss ideas at her in their half-finished state and, send her to go finish them. She's great.
I think you have hit a very good point there in terms of a business and growing a business and so on, which is the delegate. Because sometimes entrepreneurs get so involved because they're the experts in their field, and they get so involved in doing it all that all of a sudden they find themselves bogged down with the details, and they cannot accomplish what they intended to do.
Yeah, absolutely. And I see a lot of my friends in that boat. I have a lot of friends that are also small business owners, and they're complaining about the sleepless nights, and they don't have a life, and they work 7 days a week, and they haven't had a vacation since they started the business. That is not me. And I attribute it to being a Libra, even though I'm not big into astrology, but my sign has that, the scales. So I think my life is always in balance. Like, I know when I'm working too much and I'm like, it's time to get out and go to the beach. Come on, kids, get in the car. And we're good. We're headed out.
That is a gift that you're able to do that, because you're right. Most entrepreneurs just get so bogged down, they can't let go. And then what happens is your brain starts to solidify. You don't have original thoughts anymore because you're just so task-oriented, you can't have a creative thought any longer. So what you're doing is exactly right. So congratulations.
Yeah, I know I could make more money and be more, quote-unquote successful, but I'd be unhappy. I need that balance. I need time for me, time for the kids, time to exercise, all those things. And so I'm okay with making a little less money and having that balance and delegating, like you said, you know, and not trying to carry the weight of the whole business solely on my shoulders.
If you had to pick the one challenge of having your own business that you have not yet been able to solve, what would that be?
Definitely the marketing piece. Marketing, it's this nut that I'm trying to crack, the outbound marketing. The inbound marketing is easy because I can write SEO, articles and people will find me, but trying to go out and contact people is not easy at all. And then people say, oh, get out and network. Yeah, but I'm going to meet 1,000 people that I don't need to meet just to try to meet that one person I do need to meet. So that has been a challenge for me. The last couple of years, I've been trying to get out and network, and I've been not really finding it very lucrative. I've been trying to do the outbound marketing, not finding it very lucrative. You know, most people get your email and they mark you as spam, or they get your voicemail and they never return the call.
Right. Or it goes into spam automatically. You don't even get to see it. I mean,
one thing that people don't realize that is very effective in that is targeting network. You have to target whom you're going to, what areas you're going to network, or whom you're going to network with. And if you do that, you're now shooting with the rifle instead of with the shotgun.
And I need to figure that out. I guess I need to figure out where the people I need to meet are hanging out, and then go hang out there, because I'm not hanging out there yet.
That's right. That's right.
Give us an example. Tell us a story about a really, really tough customer that you had.
Oh, there's always some of those.
I know that you're like a psychiatrist too, so we understand that. But
oh yeah, and I'm one of these people that's not afraid to fire a client. So people, they just want more clients and they'll never say no. I'm not that person. And so I had one client. We'd done a project for him. I can't remember exactly what it was, but I think it was writing curriculum for some type of, maybe it was a continuing medical education class, or it was a nutrition class or something. And then he was very difficult during that process, but we completed it. And then he came back for another project, which was an edit to a book. And he had a pretty tight timeline. And we were working on it. And while we were working on it and we got into it, we realized that it was quite a bit more complex than we realized, in that, when we got partway through the book, there was actual chunks that were just missing. It was just some bullet points, or he'd copied and pasted some text from somewhere. Now we actually had to write the book, which we quoted for a book edit, and the timeline was for an edit. And so when we got to the halfway point and he got the bill for that halfway point, he was like, no, I'm not paying the bill because you haven't done this and you haven't written this yet. Okay. So I said, well, if you're not happy, because he kept saying, well, my previous editor would have gotten it done already. Hey, that's all I needed to hear. If you're not happy, you should go back to your previous editor. You don't want to pay your bill anyways, right? You're complaining about paying the bill. So I know it's going to be a risk for me to finish without you having paid the previous amount you owe. Because when we get to the completion, I'm sure you're not going to want to pay the whole amount. So I just told him, you know what? You go your way, I go mine. You don't owe me anything, I don't owe you anything. You've gotten part of the book edited, I've gotten the deposit. Go back to your old editor. And he was quite shocked. I don't think he'd ever been fired by a contractor that he hired.
Do you ever get into a situation where you need to check check to make sure that they haven't copied somebody else's publication?
Absolutely. So basically what we do, the editor within the company, Andrea, and she's brilliant, we use a number of different tools, but the most common one in the industry is called Copyscape. And it's just a website that we pay money to get credits, and you go and you paste whatever is, the text is, and it will tell you if any website shows up anywhere with that text, that's an exact match. And so
is it just on a website, or is it anywhere?
It is only on a website, but you've got to realize a lot of books now are actually on the web. And so you can get an excerpt of the book, and really the excerpts just mean you can kind of get the whole book. But that's a whole nother conversation.
And we don't have nearly enough time for that. So we have 2 minutes left before we have to say goodbye. So, Karen, I'm going to let you tell us the one thing that you would like the listeners out there to know. First of all, if there's anybody that's at Scripps or Max Planck, to be sure to call you, right?
Yeah, absolutely. Please contact me. Go to the website, The MedWriters, or email info@TheMedWriters. You know, I'd be happy to speak to anybody out there who's listening, who's in the healthcare, medical, scientific, health, even supplement and food industry, and needs some help with writing, editing, proofreading, any of that stuff.
You have a final word?
I think this has been a very enlightening discussion, Karen, and congratulations on your endeavor, and I wish you lots of luck.
Thank you.
Well, I think the two of you are going to be spending more time together.
I'll be happy to help you in whichever way I can.
Absolutely. I think I just found my new SCORE mentor.
Well, you had put in a request some time ago, and we didn't have anybody with the skills that was needed for you. And so when Evelio marched in the door and said he'd like to be a SCORE mentor, I thought, oh, wow, this could be a really good fit. So that's why, Evelio, I was hounding you to make a decision.
Well, thank you very much, Penny, for your nice words.
You're very welcome. And your phone number and website, Karen, come on, do your marketing.
It's themedwriters.com, and you can reach us, assuming that you're local, 561-247-2190, and you can email me personally, Karen@themedwriters.com, or just info@themedwriters.com.
Thank you so much for being with us. Remember, Palm Beach SCORE exists solely to help you bring your entrepreneurial dreams to reality and reality to your dreams. To celebrate the beginning of our second year on the air, we have two very special discount offers for our listeners. We want to reward you with a $25 discount to attend either or both of our two upcoming small business symposiums. On Thursday, October 27th, for our women listeners out there, we will be partnering with the Women's Chamber of the Palm Beaches for our third special Power and Grace event for women entrepreneurs. We will hear from 4 women CEOs who work with their spouses or best friend and how they deal with the extra stresses that entails on their business and on their personal life. Then, we will also learn how women can use golf as a business development tool. This half-day event will be held at the North Palm Beach Country Club beginning at 8 a.m., and you can probably meet Karen there at the same time. Then, mark your calendar for Friday, November 4th, when we will be hosting our 4th annual Show Me the Money Financial Symposium. This half-day event at the Airport Hilton features 13 workshops all about finance, financial management, and loans, all structured specifically for the small business owner. Register on our website at palmbeach.score.org and use promo code TALK, T-A-L-K, for your $25 discount. Now, for Penny's 2 cents, start by doing what's necessary, then do what's possible, and suddenly you are doing the impossible. And we borrowed that from St. Francis of Assisi. And remember, Palm Beach SCORE exists solely to help your small business succeed and prosper. The economy in Palm Beach County is booming. Make your success story a part of that boom. We'll talk to you next Wednesday, 5 p.m., Scoring Your Business on 900 a.m., The Talk of the Palm Beaches.
I want to be on the cover of Forbes magazine, smiling next to Oprah and the Queen.